Hi there, my name is Fiona Coughlin, and I am a fourth year mental health and nursing student. Thank you very much for joining me here today. As part of my nursing practice studies module presentation, I have focused my studies on the mental health promotion and lesbian, gay, bisexual, transgender, queer plus community. Throughout my presentation, I have concentrated my studies primarily on younger adults in schools and colleges in the coming out process. The aims that I hope to achieve throughout this presentation are to discuss the relevance of mental health within the LGBTQ plus community, look into supports that are available to access for positive mental health promotion within aspects of our own college, ideally nationally and internationally, define what exactly coming out means and how professionals can ease this transformative process. Give details of ways in which stigma in relation to preconceived homophobic ideas can be reduced and prevented within students and professionals, which in turn may help all people that want to come out actually feel comfortable enough to do so. Examine the limitations that unfortunately lie within our services and provide recommendations for future care and research. The stigma and discrimination encountered by lesbian, gay, bisexual, or transgender people coming out can result in extremely negative experience of being LGBT and their coming out experience. This may result in depression, engagement in self-injurious behaviour, and in some cases, suicidal thoughts. Effective information in regards to mental health promotion and accessible supports must be made available to individuals seeking help. In the following slide, I've included statistics which demonstrates to us the requirement of effective techniques and understanding in relation to mental health and LGBT community. I included this slide referring to Irish statistics to emphasise the requirement for adequate supports to be available within reach for individuals who need it. It demonstrates to us that 75% of Irish LGBTQ people report being verbally abused throughout some stage of their life, that 29% of gay men and 24% of transgender individuals report being physically attacked in public. 15% of the LGBTQ community report being sexually attacked, and 70% of Irish LGBTQ community report that they have struggled with their own mental health issues. I decided to discuss this topic as my brother is part of the LGBTQ community, and during his coming out experience, he struggled with his own mental health issues a lot. And after he came out, he was so much happier in himself. So I just kind of was intrigued as to what supports are available to young people who are seeking help in terms of coming out and struggles with their mental health during the coming out process in their locality, nationally, internationally. In 2010, Monchat and Herman defined mental health promotion as consisting of movements that inspire and assist individuals to adapt and maintain healthy habits of life and create living conditions and environments that allow positive health. Coming out is a phrase that is regularly used by lesbian, gay, bisexual, transgender, and queer individuals, opening up regarding their sexual orientation and or identity to themselves or others. One may fear family and peer judgment, and due to this, additional support and understanding by professionals, peers, and family is required so the individual can feel safe and secure in their environment and in their own skin. I wanted to include this video from an American movie called Love, Simon. It tells the story of a student coming out in school to himself and at home. The video shares a lovely conversation between Simon and his mother. An important message communicated in this modern movie is that sexuality does not define you. This is such a valuable message to demonstrate to all young people and professionals. If this message was incorporated into everyday life and learning, perhaps homophobic stigma would be reduced and positive mental health would be projected.
I need you to hear this. You are still you, Simon. You are still the same son who I love to tease, and who your father depends on for just about everything. But you get to exhale now, Simon. You get to be more you than you have been in a very long time. You deserve everything you want.
Belong to supporting lesbian, gay, bisexual, and transgender people in Ireland is a national organisation for providing information and support for mental health promotion to LGBTQ plus individuals across Ireland within the ages of 14 to 23 years. Their aim is to create a world where all are equal, safe, and valued in diversity of their identities and experiences, regardless of one's sexual orientation. Belong to represent young LGBT individuals, advocating and campaigning for their needs. They suggest specialised LGBT youth services which highlight positive mental and sexual health, in combination with drug and alcohol support, responding to requirements of young LGBT individuals. Belong to work together with Pieta House, providing counselling services to young individuals. Regrettably, for rural Ireland, these services only occur in Dublin city centre, and due to COVID-19 restrictions, these counselling services are only allowed to take place over the phone. They also offer free and confidential one-to-one counselling sessions in their Monday chats, where a non-judgmental listening ear is provided and referrals where required. Through their Pieta House collaboration, free counselling services is also provided. Within our own college, I Teach Relief, there is an LGBT society. I spoke to the president of this society through Facebook, and he described the society as a good way to make new friends and for students to build their own support systems. I Teach Relief have their own counsellor and welfare officer within the Students' Union. Students within the LGBT community are able to make appointments with these college professionals to discuss any issues they are facing. The LGBT Society cannot force anybody to attend these services, but can guide students to arrange a meeting if they are concerned about a member's health. The college does have adequate supports for mental health promotion and LGBT individuals, but upon research it may look like these resources aren't available, as the first link to appear when researching LGBT IT Tralee dates back to 2010. Homophobic and transphobic stigma and discrimination is unfortunately still very present in our world. You would think that in 2020, with the amount of progress in advocating, that all young people would have a broad mind when it comes to sexual orientation. This is sadly not 100% the case. Gosh, gender orientation, sexual health and HIV deliver workshops and training courses throughout Ireland entitled Developing Skills for Working with Those Individuals Who Identify as Lesbian, Gay, Bisexual and Transgender and Their Families, teachers and professionals who work with young individuals in their local area. Gosh's aim is to focus on promotion of equality and well-being with a beneficial and humble approach to sexual orientation and gender diversity. Gosh may refer individuals to additional counselling services and supports within the Midwest region. These workshops can contribute to reducing stigma and promoting positive mental health amongst individuals. Gosh also provides a confidential helpline. Their functioning times are Monday from 2:15 p.m. to 5 p.m., Tuesday to Friday 9:30 a.m. to 5 p.m. These helplines are carried out by trained staff and volunteers who answer any queries individuals may have in regards to gender, sexual orientation, sexually transmitted infections, and sexual health. If required, these professionals may transfer you to appropriate helplines in a confidential manner. Their office is based in Limerick City, and their operation operates in Limerick, Clare, and North Tipperary. Gosh LGBT workshop, mentioned in the previous slide, took place on October 14th in Ennis, County Clare, in Thurles, Tipperary, October 21st, and it will be taking place in Sir Harry's Mall, County Limerick, on November 4th, again in Newcastle West, Limerick, November 25th, and Sir Harry's Mall again on December 2nd. I have included this brochure, which can be found on the Gosh website, where they explain their service and their aim that they would like to achieve within different areas of gender, sexual orientation, sexually transmitted infections, HIV, and sexual health. Dublin-based LGBTQ+ helpline offers a non-judgmental and confidential service, which distributes support and information to those within the LGBT community, their families, friends, and to those who have questions about their own sexual orientation. This LGBTQ+ support helpline is delivered by a network of trained volunteers from a number of local LGBT helplines. This helpline is of access 24/7. Services included are phone line calls, instant messaging, and peer support groups. The helpline number provided is 1-890-929-839. In an American research article carried out by Ali and Lambie, it was recognised that group counselling is a proficient method for those subjected to a variety of assorted feelings in their coming out process and provides appropriate social support. Group counselling is a strengths-based interference which focuses on promoting positive mental health. It was highlighted that LGBT individuals who have previously gone through the process of coming out acknowledge that having the ability to reflect, plan, and discuss their worries in a safe environment was helpful in promoting a positive coming out experience. Shout Out Ireland is a nearly completely voluntary registered Irish charity. Their aim is to enhance the lives and mental health of LGBTQ+ individuals by sharing their own personal stories. They inform school students, parents and guardians, teachers, youth workers, and workplaces on LGBT issues through carrying out workshops in secondary schools. Their training components are inspired by the use of their own on-the-ground experience of interacting amongst young people. Workshops are currently being carried out virtually due to the COVID-19 restrictions, but these workshops can be arranged through the Shout Out website. It is vital that schools provide a systemic way of targeting adolescents in a location where they spend a considerable amount of time. Schools must understand that it is very likely that every school and classroom have LGBT students, regardless if they are out. In order for LGBTQ+ students to feel comfortable enough to come out, it is important that a positive environment and culture lies within the school itself. Homophobic and transphobic bullying must not be tolerated, and it is also important that schools safeguard acceptance of individuality, positive school environment and culture. It must be noted that the whole school environment benefits from inclusion and respect for individuality. It is encouraged that the students also benefit from subjects related to sexual orientation, gender identity, homophobic and transphobic bullying are taught in a respectful manner. The Irish Department of Education and Skills anti-bullying procedures for primary and post-primary school declared that the board of management committees within each school around Ireland must ensure that their anti-bullying policy is frequently highlighted to students and advanced on a school-wide foundation, with specific attention being drawn to providing information to incoming students and their parents and guardians. Homophobic and transphobic bullying must be tackled within their anti-bullying policies, making certain that education and prevention approaches are in position to confront this type of bullying. In Pierre Mercier's 2017 article, he addresses his own coming out experiences and the struggles that he faced, emphasizing the positive effects little big things have on the LGBTQ+ community. He provides us of examples of events such as celebrating LGBTQ+ Day on the 23rd of September, World Mental Health Day, the 10th of October, and National Coming Out Day on the 11th of October. Another example provided to us by Pierre is wearing LGBTQ+ badges within the school and the work environment. By highlighting these important days, it will shine a positive light on mental health and LGBT community and how all are accepted in this world and our community. As I'm focusing my presentation primarily on young people, I couldn't not mention social media. Social media's role on the lives of young people are expressed primarily in a negative light. Studies show that 90% of teenagers between the ages of 13 to 17 have used social media. Social media could be used to demonstrate and deliver information to young people regarding mental health promotion techniques in relation to any community. O'Reilly et al. Carried out research on social media being used for mental health promotion purposes, and the young people who participated in her studies may have been a bit reluctant at the beginning, but agreed it was a good platform to deliver information. There are, of course, challenges faced, for example, the credibility and the trustworthiness. But if social media platforms like Facebook or Twitter worked in conjunction with appropriate organisations, an example within LGBT, this would be Belong To, they could deliver information to adolescents in ways that are used in traditional help-seeking avenues. For this method to work, larger evidence base is required. In 2013, Adams recognised through his study that individuals chose not to seek help sometimes due to the financial cost. Counselling services and supports can be a bit on the expensive side, without even factoring in transport costs and the fact most counsellors work on a 9 to 5 basis, requiring one to take time out of their day to seek help. This can put financial strain on families and individuals. This could be overcome by providing information in workplaces, colleges and schools in regards to free or cost-effective services within access to them, for example, the helplines mentioned. Unfortunately, I could not locate any information leaflets online. Perhaps these leaflets should be easier to access. In regards to recommendations for future care and research, perhaps the available information regarding supports and services should be in more accessible reach. An example of how this could be done is through providing workplaces and schools with leaflets relating to LGBTQ plus community, mental health promotion, and the coming out process. Although some of the services provided were rurally based, most recognised supports were more Dublin and city based. Perhaps more rural supports are required for LGBTQ plus individuals to promote their mental health. Research on the trustworthiness of using social media as a platform in providing accurate information to adolescents in regards to mental health promotion and on issues within LGBTQ plus individuals, while social media platforms work in conjunction with adequate health and education organisations. In terms of our own college iTeacherly, additional research and work should be put onto their online platform, i.e. Facebook, or on the iTeacherly page, so that incoming and present students and their parents and guardians are aware of supports and it is known the college operates on acknowledgement of individuality. Upon researching in regards to the supports available for young people part of the LGBTQ plus community, in order to assist positive mental health promotion in their coming out process, organisations in the Mid-West region and in the rest of Ireland, and techniques found effective internationally were identified. As coming out can be quite a daunting and overwhelming process for young LGBT individuals, permitting them with the ability to openly discuss their fears to professionals and other individuals part of the LGBT community, through group counselling and one-to-one counselling, or through helplines available, can assist in promoting positive mental health. Organisations like Gosh and Shout Out provide workshops in schools for students and professionals which focus on promotion on equality and advocating for LGBT individuals. They aim in reducing stigma and eliminating preconceived homophobic ideas. Overall, I have successfully identified the aims of undergoing this PowerPoint point. I now feel as though I am more aware of ways to promote positive mental health amongst individuals coming out and the services and supports available to them. Finally, I would just like to thank you very much for taking the time out of your day to listen to this presentation. And I hope you learned just as much on this topic as I did and that you enjoyed this presentation.